Women make up 70% of the healthcare workforce, but only 20% of its leadership. On Her Story, we'll explore the careers of bold and influential women from Silicon Valley to Capitol Hill and learn how they've overcome the odds. I'm your host, Sangela Jane, and this is Her Story, a program where we explore what's beyond the glass ceiling. Well, I'm delighted to welcome Dr. Vivian Lee, president of Verily Life Platforms at Verily Life Sciences, former dean and CEO of University of Utah, and former chief scientific officer at NYU Langone. Dr. Lee, thank you so much for spending some time with us today.
It's great to be with you. Thanks for having me, Sangela.
So I thought we might start a little bit about your background and where you grew up. If I remember correctly, you grew up in Oklahoma. How did that influence your career path?
Well, I grew up in the heartland of America. We were one of very few Asian families, I'll say, in Norman, Oklahoma. But I was very fortunate because one of my very industrious teachers, actually in junior high, set us up to meet with various community leaders to try to get us going on careers. And that's when I met this man, Dr. Hal Belknap, who got me introduced to medicine. And I guess if it weren't for that, I wouldn't be in healthcare. So very interesting also, I have to say, to have grown up in the middle of America, in a part of the country, I would say that many of us who live on the coast may not feel we really understand very much. And so I think I bring a lot of that with me everywhere I go.
You know, one of the things that I was most excited to dig into with you, being a fellow academic and researcher, is you really have taken on this kind of, I'll call academic, lead with data first approach to all of your roles, both from kind of clinical practice to what you're doing now, which we'll come back to in a minute. But what influenced your decision to, you went to Harvard for undergrad, then you went to get your PhD, and then you went to med school. Like, how did you think about which degrees to pursue in your thinking there?
Well, I've always been really interested in, I hate to confess this, but I'm really kind of a nerd. I mean, that won't be a surprise to most people who know me, but when I was in school, I really loved math. And my father's an engineer, my mother's a statistician. And so while I was really interested in becoming a physician, I always had a real passion for engineering. And so when I received this scholarship, I got a Rhodes Scholarship to go to Oxford. It was a chance for me, before going to medical school, to really focus a little time on engineering. So I was able to do a research project in medical engineering there, which led to the PhD, as you said. And then after I got back to the States and went to medical school, some of that engineering actually came out in the course of my career selection, because I did end up in radiology, in particular in MRI, which uses a lot of engineering, a lot of physics, and has been something that I've been really passionate about. I didn't expect that engineering mindset would influence the rest of my career, the administrative and leadership components of it as much as it has, but it's been incredibly influential. I remember the first time when I became the vice chair for research in the Department of Radiology at NYU, and my boss, Bob Grossman, who later became the dean and CEO and who brought me with me into the C-suite. But at that time, when we were in the Department of Radiology, he said, I want you to figure out how to get our department from essentially being unranked in terms of research, research dollars from the NIH, to getting into, say, the top 20. And I think in retrospect, I took a very engineering kind of approach to it. I looked at all the data for, well, what were the top 20 programs doing in the country? What differentiated them? How could I model out, using kind of using some of the skills that I had from our work, our research work, how can I model out different scenarios? How can I do a little bit of a sensitivity analysis in terms of what were high risk investments and what were lower risk investments for getting us to a more successful state in terms of our research productivity. So that more quantitative approach, I guess, has been really core to who I am. And now that I'm back in an environment filled with engineers, in a technology company, I feel right at home. But even during the course of leadership in healthcare, I found it to serve me really well.
Well, that's music to my ears. I love the numbers. I mean, what's interesting there is, so you have more of I'll call it technical training then. you kind of alluded to, you really didn't envision that you'd be leading these multi-billion-dollar organizations as you probably envisioned your path forward. But do you consider yourself to be an accidental or intentional leader when you think about your actual leadership trajectory?
Oh, that's a really interesting question, because I think there's a mixture in your question of how much being a leader was part of my goal. And I would say there, not really. I've always described myself as being very driven, but not particularly ambitious. So I have a lot of energy. I really want to do things. But I don't think I set out saying, oh, I want to, actually, no, I didn't set out saying, oh, I want to become the CEO of a system or a leader in health technology, for example. Definitely wasn't in my mind. But I do think that all through my life, I've always wanted to, like, I want to see the solution through. If I see a complicated problem, I get super interested in it. Like, why is this a problem? How can we solve this problem? And then kind of carrying that out. And I guess I think that is a pretty important characteristic of leadership. So others may have said, may have seen that earlier than I did, that it was a journey towards leadership roles, but I certainly didn't have that ambition.
Right. Well, I think one of the unique aspects about your path is that you really have touched what I call different subsectors of healthcare. And so, like you said, now you're kind of back in the technology world, which is a little different than where you started. What prompted the decision to move on to Verily?
Well, I had been in academic medicine my whole life, and I had just finished 6 years leading the University of Utah's health system, being the CEO and the dean and the senior vice president there, which was an amazing experience. I learned so much about leading a large, complex organization that was really, really embraced innovation and was really very passionate about improving health of the population, And we got to do a lot of really, really fun things there. And then I had a year sabbatical. And in that year, I was able to write this book, The Long Fix, right, which represented not just stories about Utah, but stories really from across the country of really, really impressive and inspiring lessons from things that could be done to really, improve our health system, able, through writing the book to really digest a lot of it and kind of reflect on it. And then I was about to join another healthcare system. I already had the offer in hand. I was already calling friends to say, hey, do you want to come and join me there in this new role? And I was pretty excited about it. And then the folks at Verily came back at me, and I had already pretty much decided that I wasn't fit for technology. I mean, just to give you a sense of it, I went to my interviews clutching my BlackBerry phone, okay, into these Google Alphabet Verily interviews. And so I didn't really think I was ready for a move like that. But they came back and they said a couple of things that really persuaded me. They said, first they said, well, Vivian, if you are fortunate when you go to this new healthcare system, knock on wood, you can influence that system, you can have an impact on that community, and that'll be wonderful. But isn't that the problem? Isn't the problem that we are only seeing successes at individual centers and we can never seem to scale that success? And one thing that technology, at least this company that I'm a part of, really understands is scale. How do we actually really bring solutions at scale and that engage individuals, patients, consumers, whatever you want to call us, that really are engaging. So that was one piece. I said, that's definitely true. And then the other piece was, they said, well, you've just written this book about fixing healthcare. Why don't you come and just put that book into practice? I mean, just come and do it, come and fix healthcare with us. And so I thought, well, as much as I was interested in that CEO role those opportunities would likely still, those kind of opportunities would likely still be there. But this chance to really, really transform healthcare, I thought, okay, this will be an adventure. Let's try it.
Wow, that's really exciting. So for those of us who may be a little less familiar with Verily, could you just give a little bit of background on kind of what the organization does, and then specifically kind of where you focus a lot of your time?
Verily used to be called Google Life Sciences. It was Alphabet's purpose-built life sciences and healthcare company. Started about 5 years ago out of Google X. And when it was when Google became Alphabet, it was rebranded and we're now called Verily. And our roots are in clinical research and clinical trials, in a project called Baseline, collecting a lot of data about individuals and their health and trying to figure out how can we better predict future of health, and also how can we better use those kind of data to enable more people to participate in clinical trials so that we can accelerate the progress of innovation out into practice. That was really the cornerstone project of Verily, together with a number of projects that are around hardware solutions, so sensors, devices, surgical robots, for example. We have a whole multiple teams full of folks, really outstanding engineers doing that. And on that foundation, I was recruited 3 years ago to come in and build health platforms. So I'm the president of Verily Health Platforms, and our goal is to leverage all of this incredible capability of data and analytics and models and so on, plus the hardware and the sensors and the devices, to really improve the delivery of healthcare. And we are very much driven by the triple quadruple aim, and really think that some of the secret sauce I think that we bring to the table is the ability to ingest lots of different kinds of data about people, including new sources of data like these sensors, which can tell you, Sanjala, about your particular blood pressure, your blood sugars, your mood, your mental well-being, for example, that may be very different from me or from others, so that you can really have a personalized experience at scale. And to engage you as a patient and consumer, engage your provider, your clinician, as well as the payer systems. So our health platforms overall sort of thinking is that we need to have a viable ecosystem of products and platforms so that we can really get alignment across the system to improve health. So that's what we're doing. And we started 3 years ago, and now we have 5 businesses within the health platforms, and happy to tell you more about them, but they do focus on these different areas, whether it's digital health for people with chronic diseases, or digital health for people who have COVID. We have a COVID product, which I didn't expect to be leading, but it's a large business for us, a product around health systems, a whole business around insurance. We have a stop loss insurance business, and then one around substance use disorders. So kind of real doubling down on mental health, mental and behavioral health. So that's what we are now.
Quite a broad portfolio. I want to come to the long fix in just a second, but curious, given your origins on the data side, and now you're on the technology side, have you seen in your current role this kind of, I'll call it maybe a healthy tension between kind of the pace of innovation and scientific discovery, and then how long it takes for kind of from the system level, the incentive schemes, the payer reimbursement, for that to kind of meet where the innovation is? Is that something that you are seeing in Verily right now and kind of the work that you're focused on?
One thing that has really been eye-opening for me in moving into the commercial sector, and particularly in health technology, is the pace of change. So I just want to address that for 1 minute, because if you think about it, 3 years ago, we were just starting health platforms. We had a joint venture around the diabetes digital health solution. But most of the rest of what I described to you was nascent, or maybe a slide deck, or maybe even just a dream. And in the time that maybe if I were in an academic setting, it might have taken for me to have a faculty member get their first R01 grant. In that time, we were able to build out multiple significant businesses. That is a reflection, I think, of the pace of change that can happen, which is really breathtaking. I mean, it's, as somebody who's been living it the last few years, it's really remarkable to see. And so the challenge is, how do we marry that accelerated pace of change with, as you say, the culture of healthcare, which is very risk averse and has generally been pretty slow to adopt new innovations and new change. And I think one of the things that's really enabled that to happen, or that is going to continue to enable it to happen, is the COVID pandemic. I think with pandemic, we saw that all those telehealth barriers that for years were really, really holding us back just fell literally overnight. And I think people are seeing also with just the economic impact of COVID on our healthcare system and on our economy, we have to figure out solutions faster. So even though my book is called The Long Fix, I named it before the COVID pandemic. Now I think it's the not so long, it's probably a quicker fix, because I think we all understand that there's a lot more urgency. And if the digital health and health tech and other industries that are coming into healthcare can help facilitate that acceleration, I think all the better.
One of the things you said earlier that really resonated with me is this idea of scale. And that was one of the appeals of, making the move that you recently did. I don't know if you would agree with me on this, but I think writing and, thought leadership is another way to kind of have that skill of influence and impact. And I think I shared this anecdote with you earlier, but one of the key papers that you wrote in JAMA, I think it was back in 2016, if I remember that correctly, when you were at University of Utah, was actually the foundation of one of the dissertation papers and the work that we were doing at Emory Healthcare. And so just to say that, your influence in kind of sharing these insights and research, it really does have a tangible impact. And then, your book, The Long Fix, is really that next piece, at least, from my personal bias there. And so, as you know, on the show, we like to ask all of our guests, if you were to write your autobiography, like, what would you title your book? Well, you've already written the book. And so what really motivated the decision to take that sabbatical and take the time to write it and put it out there for the country and I guess the globe to see?
When people talk about healthcare, they often feel rather pessimistic about it. It just seems so large and complicated and difficult to understand and almost an intractable problem. But as we've seen, certainly we've seen in the last year, if we don't figure out our healthcare system, this is absolutely critical for our future success. For the next generation. There's no question about it. So I actually have emerged from my years in healthcare surprisingly optimistic. And I'm very inspired by the lessons that I've learned, not only in our own systems, but in systems across the country. So this book came out of a series of lectures that I gave to our first and second year medical students who were essentially fresh out of college. And I thought to myself, you are the future of healthcare, and I want to explain to you how healthcare works simply as possible through stories. This is not a textbook. We're not getting into the nitty gritty of billing codes or anything like that, but just to give you a general sense, how does this business actually work? It's the information that I always wish I had. When I finished medical school and even residency and fellowship, I still didn't understand how the business of healthcare worked. I didn't understand the business probably until I became the CEO. And even then, there are still some areas that I had to really learn about in order to write the book. So I wanted to make it easy to understand, easy-ish to understand for everybody, not just people in healthcare, but people who are interested in health, but also make it actionable. So I wanted everyone, I think in order for people to feel engaged in this whole issue of how can we fix our healthcare system in this country and make health better for everybody, we have to all feel like there's a role we can play. And so my goal at the end of every chapter, I have an action plan with some suggestions for you as a patient or consumer, for you as a provider, clinician, as an employer or somebody who's paying for healthcare. Lots of employers out there really struggling with how to manage their healthcare bills of their employees. And then, of course, as a policymaker. And being able to think about the problem through each of those lenses, I found it to be really empowering and just really helpful. Like, firstly, I'll just give you one example. So, we talk about the cost of care being so high. And a lot of the narrative is between doctors and insurance companies and this sort of battle between the two about, who can get paid more, et cetera. But really, at the end of the day, you have to realize that each of us individually as patients, we're the ones that are paying all these huge bills, right? And we're not paying once, but we're actually paying through our taxes, we're paying through our copays and deductibles, but we're also paying because all of these healthcare costs are coming out of our paychecks. We just don't see it. We haven't seen significant rises in income over the last 40 or 50 years, mostly because it's been going into healthcare. So we each have a role to play. So when your kid has a cough or cold, they don't need, for the most part, 99, huge percent of the time, they don't need antibiotics. So don't go and demand those antibiotics. If you have a little back pain, you don't necessarily need the MRI the day that you started getting a little twinge in your back. And so there are things that we individually even can do in order to help our healthcare system get better. So kind of tying that all together and getting a bigger vantage point. So for me, writing the book was really more about organizing my own thoughts. And then now, of course, having the chance to share it, especially with people who are new to healthcare, like the tech industry, which has been really, really fun, as well as with trainees, students, residents, fellows, pre-meds even. A lot of people have been giving my book to their nieces and nephews who were thinking about a career in medicine. And so that's been really fun. That's been really gratifying.
Well, I think that's so powerful. And, for what it's worth, I actually did assign a couple of segments to my students over at Hopkins because, to your point, healthcare is so complicated. And, where do you start? Where do you learn the context? And so anyone coming into the industry or switching between sectors in the industry, you have to have a frame of reference of why the system is the way it is. What's the origin story to be able to then come up with the solution? So there really is no good textbook, but I think your practical view of how you've laid it out really is a great toolkit. So thank you for taking the time to write it.
Thanks for doing that. Yeah, I've been visiting some classes and doing some of these talks. It's really been fun, and it's really inspiring because that's what this next generation wants to do. They want to come in and help fix healthcare. So that's fabulous.
One of the premises in your book that I really resonated with me was this idea of silos, right? So you basically say we all have a stake in this game, right? Payers, providers, patients, we all have a role to play to make it better. How do we actually bridge those silos? Like what's going to move the needle when we to break those barriers down?
Well, at the end of the day, we really have to realize that the main area of focus has got to be improving the health of our patients. And when we lose sight of that, then we kind of go back into our silos. We become health system A or clinic B or insurer C. But the focus has got to be really centered around the individual as the patient. And I have this, I borrowed an idea from the Bataldens called co-producing health, that the model for how we really need to think about the delivery of healthcare is that healthcare systems, clinicians, physicians like you need to work with patients to co-produce health together. So much of health is determined by what we eat, how we sleep, whether we're taking our medications that are recommended for us, for example. And so it just needs to be a partnership between the two. And if we can actually really engage the patients and their providers together and create that as the central team, which I think actually a lot of these digital health solutions can do a lot to advance, then everything falls out from there. Then you have patients who understand and who are engaged in their care, who can not only participate in terms of, like, let's say, preoperatively getting themselves to a better state to get into operation, but also be able to understand more how they can prevent a readmission. And we could just get a lot more alignment around health. And then we simply have to remember that healthier people cost a lot less. So if our focus is on how do we get to that better health, whether it's through public health, or through prevention and primary care, or even around in the tertiary areas, just engaging people so that they can prepare better, then that's going to be the key driver.
So you mentioned, COVID accelerates kind of the trends and the pace of change, which I could not agree with more. As you kind of think bigger picture now to kind of the post-pandemic health system, and you mentioned, the early career students and those who are wanting to have an impact in healthcare. What do you see as kind of the new competencies or areas of focus that kind of the next generation of leaders are going to need to have to really, come up with the right solutions and strategies?
What COVID has taught us is that our current health system is completely broken, and it's made it very apparent that, a fee-for-service model of healthcare has made our health systems very vulnerable. They were laying off millions of healthcare workers early in COVID just because the patients, the elective patients weren't coming in, as you know, and so that model really wasn't sustainable. Whereas the businesses like the Medicare Advantage businesses, the military health system, where the VA, where those groups were being paid a fixed amount of money to care for their populations, those folks actually did very well through COVID, and they were able to invest those dollars in looking after their patients, especially those with chronic diseases or those who are elderly at home and so on. So what we've learned from the pandemic is that we really need to accelerate the move towards more of a truly value-based healthcare system. And the skills that leaders need, I think, in order to be successful in leading a value-based model of care are probably not that different from what they used to be, but they would include a real understanding um, of what are the factors that most improve health outcomes, that most prevent hospitalizations, and are more focused on the public health and primary care and preventative side. How to use data, and how to use data and predictive analytics to identify which patients need the most focus and need the most care, and then how to really create a system that is really inclusive of all populations. One of our biggest challenges is inequities in this country. That's the reason why our overall mortality and our overall infant mortality, maternal mortality, life expectancy are low. It's not because the highest end aren't high enough. It's because our average is so low, because we have so much disparity in this country. So I think that's the other really important skill set, I think, that next generation has to bring to the table, which is how can we build a health care system that is much more equitable, that addresses the needs of all of our communities and all of our population.
Absolutely. I mean, speaking of skill sets, I mean, just thinking about your own journey. I mean, you trained, clinically and with the data orientation, and now you're leading all the systems level change and thinking about technology. I mean, how have you gone through that journey yourself as you think about, your different progression points? I mean, were there certain skills that you had to intentionally, seek out to build, or different trainings? Like, how did you think about your evolution?
As I mentioned at the beginning, I wasn't particularly focused on a specific destination. I don't really think I was ever thinking particularly about an evolution, but what I did do was whatever stage of my career, I always really dove very, very deeply into whatever I was doing. So in the earlier parts of my career, for example, I am an MRI radiologist, very focused on research in terms of developing new MRI techniques for cardiovascular, kidney function, and other areas. And I was intensely focused on it. I at one point had a lab with 3 R01 grants. Did a lot of publishing. I think that is what led to my election to the National Academy, was that work. Super interested. When it came to now thinking about, okay, how do we actually improve research across an entire institution? That's a really interesting question. How do you actually, what are the important skills and toolkits that we need to provide to our researchers so they can be super successful? So extending from beyond myself and my little MR world to, oh, how can I help the people who are doing discovery science all the way to people who are doing population and implementation science, and what tools do they need? And so I really studied that carefully. And that's actually what led me to go to business school, to do the EMBA, because I felt like there were probably more skills that I could really learn. And that was incredibly helpful, whether it was strategic planning all the way to operations, how to create efficiencies, improve efficiencies, for example, all the way to crisis communication. How do we communicate more effectively about what we want to do? And then I got into the question of our broken healthcare system. Like, why is our healthcare system so broken? What is it? What is it about the financial model? What is it about how we run? And then as we already talked about, I started thinking about, well, what could really make a difference? What could leapfrog us from this current situation into a world in which we challenge the existing paradigms in a really disruptive way? And I actually think the technology can really do that. And so I've really immersed myself in that. And I'm actually studying data science now. I'm trying to understand, trying to do a little coding in Python. I'm not a coder at all, but I'm trying to learn a little bit just for fun, just to understand a little bit. So I think that's really been the way in which I've thought about everything. I deeply immerse myself in whatever it is. And then and amazingly, these things that seem completely unrelated and disconnected actually have served as a really strong foundation for me. And I use lessons from each of these different phases of my life in really unexpected ways. So I'm a champion in not being overly programmed and overly directed, I guess, or at least that's how I've ended up.
Building on that, what role did mentors play at different points in your journey?
That's a really interesting question, because you've asked the question mentor as opposed to a role model. So I've had some really wonderful mentors, whether it's in the research side, people who have taught me about MRI and how to do research, I learned a lot from Bob Grossman, who was my chair and then my CEO and dean at NYU, and he still is there, about how to lead an organization, especially in a very data-driven way, to your earlier question. Um, I've had probably more mentors that, more people who maybe not be, I wouldn't say that they're formal mentors, but people who have taught me things, lots of different dimensions of skills and insights since that time. I wish I had more mentors, actually, more people who I could say formally, oh, that is the person who has personally guided me along my entire life. But more, I've really been the beneficiary of lots of really good people supporting and providing good input and good advice and good feedback along the way.
That makes a lot of sense. I mean, maybe it's the academic orientation, but similarly, I would say I think I have a lot of teachers more than actual mentors. So it sounds like you probably fall in a similar camp there. So it's interesting. You talked a little bit about your origin story in Oklahoma and being, probably one of the only Asian Americans in that community, and so that's an interesting dynamic. Thinking about what role models or kind of other individuals you could look up to that kind of represented a lot of your similar attributes, so to speak. At what point did you kind of think about that your experiences or opportunities were different because you were a female leader? Did that ever kind of present itself in any way?
Oh, just a few times. When Bob Grossman asked me to be, I was already his vice chair in the Department of Radiology. And when he asked me to be the vice dean for science, the chief scientific officer at NYU with him, which was really a real honor, I was pregnant with our third or our fourth, I think our fourth child. And we went through this period when we went around and we were the new leadership team, and we did a whole bunch of these town halls to meet all the different, parts of the medical center, which was pretty large and pretty complex, as you can imagine. And it would be me and these 5 guys who were all a little bit older than me, a decade or more. And there I was, sort of progressively more and more obviously pregnant, and kind of at the end, kind of waddling on the stage for these town halls. So I went through a period when I started in that role where I would just avoid reflective surfaces, because if I saw myself in the mirror, I would just start to laugh. I mean, like, I didn't even, people talk about imposter syndrome and not looking the role. I mean, I really did not look the part. It was really funny. So yeah, and I think there are stories when I first matched in my residency program. I was the first woman. I started out in surgery at Duke, and I was the first woman to match in that program in a long time, in many years in general surgery. There had been some other women who had come in and transferred in, but I was the first one to match there. So I remember when I went in to pick up my white coat and what I thought were going to be white pants, I was handed some white triangular skirts. And I said, can I wear pants? I'm like, we don't have pants for women, So yeah, I would say pretty much all along the way, I was fairly aware of that. I can't tell you how many meetings I've gone into where I'm the only woman.
To that point specifically, right? So as you know, I've spent a lot of time working with health system C-suites, and one of the studies we did, these numbers might be slightly outdated, but we looked at the percent of health system CEOs that were actually female, and then also female with a clinical degree, or just kind of looking at different profiles. And the numbers, if I remember this correctly, it was close to about 19% on average of health system CEOs were female.
When I first started in Utah, I think I knew the numbers. It was something like 12% of medical school deans were women, and 10% of hospital CEOs were women at the time when I started. So 19 is already almost double.
That's true.
It's terrible. It's super low, but I'm just saying it's way better than when I started.
That's a good point. I guess it's relative. Yes, we are slowly but steadily making some progress there. But to your point, and I'm not as familiar with Utah, but from my own experiences there, it's a different patient population there too. And so being an Asian female leading this large organization in their communities, I mean, how did you navigate that? I mean, how did you get them to really take you seriously?
Well, first of all, it's really important to remember that women make up the majority of healthcare decisions for their families. So I haven't actually seen any of the original research, but people often say 75% of the healthcare dollar, the decisions on how to spend those are made by the women in the family. So if you are going to lead a healthcare delivery system, or anything in healthcare for that matter, effectively, and you really want to connect with the most important constituents, then you really need to be sure that you are attuned to your customers. And that's true whether it's gender or racial or ethnic or cultural backgrounds. We have to be sure that our leaders and the people who have an influence over the products and the businesses that we are building, and the people that we're serving, that they are representative, the people that of our customers. And so I think that's actually really, really important. It doesn't exactly address your question about, how to get people to take me seriously, but I think from a broad perspective, we need more women and much more diversity at the table in healthcare. That's maybe one of the reasons why our healthcare system isn't serving everyone's needs as effectively, because we don't have that representation right now.
I know we're hitting up against time shortly here, but, wanted to get a little bit about, you mentioned 4 daughters, and you have a husband that also has a really impressive career. And from what I understand, I think you split your time right now between 2 to 3 different cities. Like, how do you juggle the personal with the professional, just given everything you have on your plate?
Juggle. So have you seen this cartoon? There's this cartoon where there's a hen, and then there's a row of sort of hens and chickens sort of sitting in a circle around the hen, and the hen is juggling these eggs. Have you seen this cartoon?
I have not.
And one of them one of the chickens on the side is saying, "I love how she juggles family and career." Do you get it? Anyway, sometimes when I look at that hen juggling, I'm thinking, yeah, that's me. And they are eggs and they're kind of fragile, I'm glad that you didn't say balance, because I'm often asked about work-life balance. And I think, not balance isn't really the word. But I think that it's really important for me personally. What has sustained me is that, first of all, I have a great family, I have a great husband, I have great kids. And also I love what I'm doing. I love what I'm doing at work. I just think it's super interesting. I think I'm the luckiest person in the world. Pretty much in every job that I've had, I feel so blessed that I've been able to do really, really interesting things. And then I love my time at home. I love my time with family. Now, we may not have the most organized household. My kids' socks did not always match. I think that's the most important thing, is to really love what you do.
Absolutely. From a personal front, like, what is something, do you have any hobbies or kind of your go-to decompression tactic when you just need time for you after a long day, a long week?
My time with me is mostly my time with my family. So if I have any free time, when I have my free time, I spend it with my kids and my husband. Yeah, and then we go do stuff. We walk, we bike, whatever. During COVID, we mostly were biking around Manhattan, which was kind of interesting, kind of fun, kind of dangerous. But actually, it was almost surreal because, Times Square was completely empty and we're just riding our little bikes up and down Times Square. It was amazing. But yeah, I'd spend time with the family. I read, I try to do a little workout, that kind of thing.
I'm trying to envision biking in Times Square right now, but it's kind of surreal to imagine. Given your experiences thus far, is there something that you believed early on in your leadership journey, some piece of advice that someone gave you or whatnot, that you now look back on and you're like, that's not true, or that's not really how I think about it now?
Yes, I although I think I recognized it at the time, it didn't take me very long to realize it, but I remember early on in my career when I had a leadership role, and my approach to the problem, which was to develop a strategy, like I was charged with building this program and developing a strategy for doing it. And my approach was to bring a number of people to the table and have a discussion and get their input about it. And I remember afterwards, one of the leaders pulled me aside, who was somebody who was very distinguished and senior to me. And they said, Vivian, that's not how you lead. You can't ask everybody what they think. You need to just tell them. That's what a strong leader does. And I remember thinking, I don't think so. Like for me, I want to hear the input. It doesn't mean I have to do what you've told me. But certainly the input is incredibly invaluable. And so, yeah, there definitely have been times when I felt like maybe it's important to stick to what works for you, and what works for me has worked out okay.
So I guess then final question, the converse of that, what advice would you give to your younger self?
Superficially, I should have studied some economics when I was in college. I really should have. Not knowing any econ until I went to business school, that was silly. I wish I'd written more. I guess I would have said one of the things in writing a book, it's just so helpful to write more. When I went to my college reunion, one of my reunions, I remember there was a panel of all these writers, and they said, one of the guys especially said, I wrote 1,000 pieces before I could bang one of these pieces out, like, in a weekend. It just takes practice. It's just like the piano. It's just like, Malcolm Gladwell or whatever. And I wish I'd done that, because I think I'm an okay writer, but I wish I were a better writer. And other than that, I would say don't sweat the small stuff. Just think. Oh, you know what? I have one other. Mario Capecchi said this. Mario Capecchi is a Nobel laureate at Utah, and he said something that was very profound that I always wish I had heard when I was younger. And he said, I'm going to paraphrase him, but he said, you can work on. It takes as much effort to work on small problems as it does to work on big problems. So why not work on big problems?
I love that. I really love that. It's great. Yeah. I would want to land there, but you got me on the writing piece. So one final question. The writing piece is really important. It's something that a lot of our colleagues talk a lot about is, how do we share ideas and thoughts and kind of foster this kind of national dialogue in other ways? What advice or kind of tips and tricks would you have for, I'll target it towards a busy executive, but really anyone who is trying to hone in on writing as a skill, like any kind of secret tips as you were thinking through your book or other writing that you're doing now?
Well, I think it's really important to understand who your audience is and to write to that audience with the right voice. So all of the writing that I've done in the past has all been academic writing. My first book was Cardiovascular MRI, from physical principles to practical protocols. Okay, quite a few equations in there, lots of pictures, but they were pictures of MRIs. Very different from The Long Fix, where I was targeting the general public and people who, have a healthcare interest. And so I think thinking about really who is your audience, and then writing to meet those needs. So I was very fortunate that in the course of writing The Long Fix, I met a guy who happened to be the father of one of my daughter's fellow hockey players, from the hockey team. And while we were hanging out on the weekends at these tournaments, he agreed to help just take a quick look at my book. And he used to be an editor for major magazines. And so he just took a look at it, and basically it was a little bit devastating, but it was really good. He would write along the side, like, this is jargon, boring, jargon, boring. And I realized, okay, the normal layperson does not find this fascinating. So let me tighten this up and let me spruce this part up. And it was really helpful.
Well, Vivian, thank you so much for spending some time with us today. Your story is just really inspiring, and I can already see every young healthcare person interested out there is just trying to channel all your philosophies out there. So thank you so much for sharing your wisdom.
Well, it's nice of you to say that, but you are inspiring to all of us too. So thank you for all you're doing.